Okay, so a bit of housekeeping. What we're going to do, Sanj and I will take the webinar today. We usually follow the same webinar format, or the same format for our webinars, in that we will just run through the presentation on the overview of the technology of the kit and how it works, where it comes from, how it interacts with everything, where does it live, and then we found it beneficial to open the floor up to you, to ask to see what questions you have. So we have no issue with answering as many questions as we can. And if there is anything that we can't answer, we will come back to you afterwards. So if you can pop any questions that you have into the chat, what we'll do is Sanjeev and I will work through those. We'll probably take a little break in the middle and answer some of the questions, and then we normally allocate the final 10 minutes or so to questions and answers, which we've seen have been very, very beneficial. The reason we do that is that what we've seen is that you will have very specific ways of working, and you'll have really specific questions that you want answered, i.e., what would I do in this scenario? What would I do in that scenario? How would it recognize this letter or that letter? Can it send it here? Can it send it there? Can we use our templates, and can you make them visible, non-visible? All the stuff that you want to know on a day-to-day basis, around how you can manage all of your letters and emails if you were to use this tooling. So a bit about us to begin with. JIFJAF built the MyBotGP range. These are purpose-built automations for primary care. They are very different in that they are delivered as a service. So what does that mean? They come from a hosted. That means they come from a hosted background, and I'll cover off what a hosted environment, and I'll cover off what that means in a second as well. So we were part of a Health Innovation Network Launchpad program, which is a government and health innovation network program for innovation, for launching companies who are creating innovative tech in healthcare and outside of. I can also confirm it's not on our literature yet, although it is on our website, and it will be updated in our literature a bit further down the line when we have some time. We are also an official NHS partner for an ICT in London, HBL ICT, who have a hosting centre that lives in an ICB. I believe it's Hertfordshire and West Essex ICB. So we are an official partner of HBL ICT. An ICT, for those of you that aren't aware, although I'm sure most of you are the companies that support all of your IT. So they're the ones making sure that EMIS and System 1 and Accurix Ardens and all the different applications that you use are working and providing you with computers. So it's a big thing for our clients now that we're a partner, we're an official partner, because what it means is that MyBotGP, from the end of last year, only lives in an NHS hosted environment. So from a compliance and DTAC and DPIA perspective, it's going to be really tidy and straightforward. It lives in that environment, and for anyone that acquires our tooling, we just plug in. And then you tell MyBotGP what to do, which again we'll cover off in this presentation, and it will just run and do it in the background. So think of it as a remote worker. So, and again, all of our paperwork will cover that off. So we came from this program, and we are an official NHS ICT partner, which is super cool. We have a strong track record in working in primary care and the NHS. So what does that mean? Well, it means pretty much what we put there. We've got a lot of experience at working in primary care. Our tooling at the moment consists of Docman, normal pathology filing, which we have a MyBotGP live running, and it works for both EMIS and System 1. That tool is capable of, we have clients managing up to 200 different pathology tests through a self-configurable platform, so it's saving a considerable amount of time. All of our tooling can be acquired at practice level if you like. It can also be acquired at PCN level or federation level if you like. it's up to you. So if you were to acquire as a PCN, as we're seeing lots of purchases starting to happen now, what that would mean is that if within your PCN you're all working independently, each one of you would get your own copy. Why is that important? Well, it's important because you will all have your own way of working. So your PCN can make an acquisition and everyone gets their own copy. Or obviously you can buy at practice level. Installs are super fast now, just as I touched on before, with all of our kit now living in an NHS ICT hosted environment. It's a question of signing off paperwork, username, password, permissions, plug in, and it will start working straight away. All of our tooling has DCB 0129 certification. That's an NHS prerequisite covering risk. So I can confirm our tooling has a DCB 0129. So that's the intro stuff over. For those of you that have seen this presentation, you should have all been sent a copy of it, and it's a quite similar one to previous versions, but it's the same logic. This is the challenge at the moment, and it's getting bigger. Obviously, with lists increasing, you know, more longer term health conditions, your paperwork is getting bigger and bigger and bigger. Thousands of different letters from multiple different sources, all saying the same and different things. So on average, and obviously taking into consideration this is extremely important work, not everybody can do it. And it has to be done by specific people within specific timeframes. So on average, what you have is a list with 8,500 patients. A practice with an 8,500 list is receiving approximately, give or take, some considerably more, some a few less. So we put this as an average, about 125 letters a day. So believe it or not, that totals a staggering 39,000 letters a year. So invariably what's happening is you have 39,000 letters a year are being manually entered, validated, attached to the patient record, and distributed to the appropriate place. So if we unpack that a little bit, what does it actually mean? Well, it means that 39,000 letters a year, whether are being double checked to be correct when they're being uploaded into the Docman template, whether you're using IntelliSense or not, by a human, and then they're being manually filed by a human. That's a lot of time-consuming work, and there are multiple letter types and multiple different actions around that. Lots of these letters don't need to be seen. For example, 111 letters, unless there are particular keywords on those documents. So some of that stuff could, in principle, just be picked up and filed and not looked at, and DNAs. Other letters you might have decided at practice level that you don't need to look at could just be referred directly to pharmacy teams or colleagues. Other letters you might have decided in advance you have specific people you want to look at. But essentially, without this type of automation working in the background, you have the same group of people doing all of the work themselves. And again, we've got lots of people on this call, and you will all have different flows around Docman and how you manage the tooling. So what MyBotGP does, think of it as the initial validation, and then the distribution and filing. So MyBotGP will manage all of that. So think of having a specialist helper whose responsibility in this scenario of a list of 8,500, their job is to get 39,000 letters on the system correctly and distributed to the appropriate person in as close to real time as is possible. So MyBotGP will manage all of those. It will ensure letters are dealt with quickly. It will help you get back thousands of hours a year of physical time and cost. Why is that important? Well, it's important because you're all working extremely hard, and you've got other work that can be done. If you can remove a chunk of a task, which is basically a cut and paste, it can help support increased resilience for staff shortages, holidays, sick leave, people leaving, and free time at the practice, which is something you need. The other thing that this will support is minimizing mistakes, because you show MyBotGP how to recognize a letter once, and then the second time it sees that letter, it won't ask you what to do, it will action it for you. So if you're allocating a particular code to a letter, we're not talking about a medical code, that part is left for the people. If you're allocating a particular code or place to set or stroke and place to send the letter for the first time, and that's done correctly, the second time it sees it, it's always going to follow that protocol. So you start to reduce any potential errors. So MyBotGP will work pretty much 24/7, 365, with or without IntelliSense. It's scheduled to run at different times of the day. It will connect directly to Docman and collect all letters. We also now have it reading NHS mail. So as you're getting more stuff through NHS mail, it will support that as well. It also means that for the letters that you are receiving by hand at the practice, they can be scanned and emailed into MyBotGP and Docman, and it will pick it up and process them for you. Obviously, handwritten letters are quite challenging, and if something's illegible by hand, it's going to be illegible to the tool. But with more time available, you can read those yourself. It can recognize, validate letters and emails, file and triage as per practice protocols. There is also a really comprehensive audit log. So anything that it's touched, there's a footprint of. And again, I've got a quick screenshot we can show you in a moment. So coming back to this, what is it? You are essentially getting multiple letters and letter types covering all different topics and conditions that need to follow multiple different protocols, and you are casting your eye over each one so that this template can be completed. And it can be filed and triaged to the appropriate person. So, and again, in a minute, a bit further down the line, we'll show you a short demo. But MyBotGP essentially will complete this template for you, because you show it how to recognize a letter once, you confirm what that letter is, where to look for a date, is it in the middle of the page, top of the page, bottom of the page, visible, not visible, all of the relevant capability within Docman, and the second time it sees that letter, it will do it for you. So if we bring it back to this, so MyBotGP will collect, validate and complete the Docman template. It will validate the NHS number, so the patient, document type. It will categorize the letter because you've told it what category to give that letter, and it will apply all relevant information for each document, i.e. event date, department, organization, clinical code to categorize the letter. We are not saying it's going to read the text and make a medical decision based on next steps. That's not what this tooling is designed to do. It's designed to do everything else. Create reviews and so on and so forth, and it will add it to the patient record and assign it. So what do we mean by that? What we mean by that is, depending on how you're set up, we have some clients that everything goes to the coding team. We have some clients where everything goes to the coding team, they read it and then they distribute it to different people to make decisions. We have some clients where everything goes to the coding team and they've been given permission to code, so they code. We've got other clients where that's split off into different letters, go to different places. And I guess what we're saying is that our tooling can replicate that flow for you if you wish. But in addition to that, any letters that you've decided in advance that you don't need to look at, like DNAs or 111s that aren't highlighting a particular risk, can be just filed, and you'll have an audit log of that. So you remove that entirely from the team. And there are whole tranches of letters that sit in that format. As I was saying at the beginning, pharmacy letters can be triaged elsewhere. And then the remaining letters can go to different folders or templates or places or people as you wish. We're there to save time. Coming back to the management and distribution, as we were saying, it's all very well that you've got something that can pick up all the letters and validate all the letters for you, but in reality, who cares? What are you going to do with it? What are you going to do with them? Because that's the important thing. It's one thing validating everything and getting onto the system, but phase 2 is what you're going to do with it. Well, what it will do with each letter is what you tell it to, because you teach it to recognize a letter, each one once. It takes a couple of minutes to teach it a letter once you're familiar with using the tool. And then you say, right, this letter relates to this. This is the code. This is what I want you to do with it. And I want you to push it to this folder, or I want you to push it through this template, or send it to this person or this team. I want you to create reviews, assign tasks or not, and so on, or notify users, escalations, all of your existing functionality. And you press save, and it will do that. So coming back to it, it's going to pick the letter up. It's going to look at the letter and say, have I been given permission to look after this letter for the practice? Yes, I have. I recognize this letter. I'm going to complete the template, and for this particular letter, I'm going to use the date in the middle, and I'm going to use this keyword, and so on and so forth. I'm then going to push it here through the Docman functionality. I'm going to push it to the appropriate place, so that the right people can see that letter. Also, it can be filed away. Next stage is, as you would expect with this type of tooling, one of the advantages of it is there's a super comprehensive audit log. Audit log will cover everything that it's done. So you'll have physical proof of all Docman filings by date, by document category, and then a detailed data view of filing. So what does that mean? Well, in this scenario, what it's saying is I've filed X amount of letters today for you. Well, that would probably be in about half an hour. These are the different types of letters. But I've seen these letters and you haven't given me permission to action them. Do you want me to? And you click yes. And then you'd open up each letter one by one. Teach it to recognize it, as we just went through before. Tell it where to send it, press save, and then it won't appear in that bottom list again. It will, next time it sees it, it will push it through. So there's an initial training period. It's a couple of minutes a letter once you're familiar with the tool, but the good news is you only have to show it how to do it once. Second time it won't ask you. And then because of the way it's set up, it also means you can have different versions of the same letter. You just teach it to recognize those independently. And every time it sees a letter for the first time that it hasn't seen before, it will flash up in that panel and it will say, I don't know what to do with that. You've not given me permission. Please tell me what to do. So the way that we, and that's emailed to you every day, and there's obviously a comprehensive audit log in the application itself as well. All of our tooling is sold on a subscription basis. So that means essentially that you have unlimited letters and unlimited letter types for a fixed price. So our pricing is quite straightforward. It looks quite bedazzling, if that's even a word, the first time you see that, but it is actually quite straightforward. You have 749 times list, sorry, 749 plus list times 30 pence for MyBotGP, and then we provide a hosted managed service, which is living in an NHS ICB's hosting center, as we touched on at the beginning of the call, based on how many patients you have, and that's on an incremental basis. So up to 10,000 is 7 pence. Between 10 and 15,000, you would pay 6 pence on that 5,000, and so on and so forth. There's also bespoke quoting for PCNs as well. So we can give tailored pricing for that as well. So there's quite a lot of information to go through. So it's probably good to have a quick pause now. What I will do is I'll stop sharing my screen here, and then Sanj, have there been questions come in the chat? Good. Okay, so I'll stop sharing my screen. We'll move to questions. We'll go through the questions for the next sort of, well, however long it takes to get through the questions. Then we can get back, can show you the tool in action again properly, and then if we've got more questions, we can cover those off at the end. We will share this webinar, as you know, after the call. It will be on our website. Just give us a little bit of time to get it tidied up and put on there. And then if anyone needs to any other questions in addition to that, please let us know. But the principle of this tooling is you've got 39,000 letters a year based on a list of 8,500 patients that are being manually validated, checked, and added to the patient record and pushed through Docman. Our tooling will take over that task for you. All letters and all emails. It will complete the Docman template for you. You teach it to recognize a letter. Second time it sees that letter, it will just do the work for you. And then I always like to say the who cares. So it's great it's picked the letter up and recognized it, but who cares? Well, What's the next step? Well, the next step is what you're going to do with it. Well, what it will do with it is what you tell it to do with it. It will push it to the appropriate team, folder, person, group, wherever you think is appropriate, using the Docman capability. And there's a full audit trail, and all of our kit, as I said at the beginning of the call, we're pleased to share that as of about a month ago, 5 weeks ago, we became an official partner of an NHS ICT. So all of our stuff will live lives in an ICB hosting center. So I'm going to stop sharing now. Okay, and open the floor up to questions. Sanj and I will cover both the questions together. We are in the same room, so we'll try and remember to mute when the other one's talking. And we'll go through them one by one. So if I read the questions out, should we share the screen? Yeah, okay. Give me 1 second. So I'm assuming we can hear you now. Great. Okay. So Ian, if you can't hear us, I'll make sure that you're emailed a copy of the webinar. So you've got that, and obviously contact us, or we can contact you. We can go through the tooling with you. So does it work on attachments only in an email, or can it read the body of the text if no attachment? I've talked a lot, so I'll let Sanj jump in for this one. Sanj, over to you.
Yeah, but what it does, it looks and files all letters which are in the not in folder inbox. So yeah, if you have the NHS mails and so forth coming into the not in folder, it will pick up the attachments, etc. within that. And then once you've trained it, prior to that, obviously, it will then look to file those documents.
Thank you. So if a practice wishes to amend their initial agreed protocol processes, can they do this at their end, or would they need to notify JIFJAF? Sanj?
Yeah, again, one of the biggest USPs of the tooling is that you've got a self-configurable app, which essentially allows you to train each document, and if you need to change how you want to file that document, you can do so at by simply logging into your own app. You're given a couple of apps which stores all of the settings of how you file, and you can change them on a daily, weekly, monthly basis. It's entirely up to you.
Thank you. So yes, you can. When the letters are changed in secondary care, would it be able to adapt to that, or would it be rejected and then need to be reconfigured? So I can answer that one. They will be rejected because it wouldn't be safe for the tooling to attempt to recognize something and action it without permission. So it will be rejected. It will show in the panel as a new letter, and then what you would do is teach it to recognize that letter. Once you're familiar with using the tool, like all tech, at the beginning, the first 10 or 15 letters, you'll be quite nervous. And then once you've taught it to recognize 10, 15 letters, you'll be confident with the tool. It's it's about a couple of minutes, 1 to 2 minutes per letter. So you'll just teach it to recognize that letter. And then the second time it sees that, it will handle it as you've told it to handle it. And that's one of its strengths, because your letters change all the time. I can cover the first part of this one, and then I'm not sure about the second one. So will it recognize duplicates? So we don't touch duplicates. It's not safe for us to touch duplicates because it might not be 100% duplicate. So if you follow through the logic of us picking up a duplicate, the next decision point would be what we're going to do with it. So then presumably it would be delete it. And for feedback that we've had from our testing sites and our safety officers before going live with this tool is that not all duplicates, although this sounds like a ridiculous thing to say, are an exact duplicate. There could be a page missing, and that still needs to go through people. It is on our radar, and we do update our tooling, so it is a nut we're looking to crack, and hopefully with time we'll find a solution for that. But as of today's tooling, we don't touch them. And I guess I've just understood. So you're saying it would relating to that letter. Yeah. Okay. So we'll jump to the next one. Is there anything in the roadmap for MyBotGP to be able to file documents received direct directly to the clinical system, such as 111 documents or community pharmacy outcomes, for example. Sanj? Can they be pushed through to Docman?
Yeah, I was just going to say that. So I think any document type, as long as it's coming into the not in folder inbox, can be trained. You essentially provide it a name, a document type name. It will have an example of that document, and then you just train it as in, where to pick up things like event data, descriptions, folders, create reviews, etc. So I think just coming back to that, if it's coming into your not in folder within Docman, yes, it can be trained, and yes, it can be pushed through the system.
So what you're saying is it can recognize any letter type.
Correct.
You just need to find a way to. You need to find a way to get it into the system. Yeah. Okay.
That's great. Yeah.
Cool. Okay. If a letter has been configured incorrectly, can it easily be rectified? Yes. That was the question that came up a bit earlier. You can log back in and change it. Yeah. Will this work in Wales? We would love to start working in Wales, and we regularly have practices in Wales and Scotland, for that matter, approach us asking if the tooling will work. There's no reason why it won't, but then they disappear. So if you would like us to investigate that, we're more than happy to do that. But as long as you're using Docman, then the tooling will work. As long as we can log in, and I understand that's where there are some interesting conversations, but I don't believe it's not possible, then it should do, yes. But happy to follow that up separately. If a letter has an urgent action, we would usually prioritize that letter for coding. Is there a way the bot can be trained to recognize a letter with an urgent action? Sanj?
Yeah, really good one. 100%. So what you would do in that instance is during training, you would tell MyBotGP how to classify it as urgent. So you would give it a keyword or something which denotes it's urgent, and that will then you're then able to put it to a different folder, different create review, different template, etc. But it's all about, with any letter, it's about classification. So how can you uniquely classify a document? So for these urgent letters or high risk letters, what are the ways one can actually classify? And that could be through which is done through a series of keywords or keywords which you do.
Okay, thank you. Can we show the pricing slide again? Yeah, we can do that. Can you see that? Can you see my screen? Sanj, is that coming through?
Yes, it is.
Yeah. So unlimited pages and unlimited letter types. There is a 749 plus list times 30 pence. So the example there for MyBotGP is 749, and an 8,500 list would be 8,500 times 30 pence. So that comes to 2,550 plus 749 is 3,299. That's our MyBotGP cost. And then to have it delivered as a hosted service, a managed service. So what that means is a computer in the sky in the NHS hosting center will be plugged in and managed by us as well. Obviously, we can't see any private data. For that size list is approximately £49 a month. We can cover off pricing again a bit later. We don't use Docman. Are there any plans afoot to link it straight into clinical systems? We are looking at it, yes. We can't promise it's going to come super quick. These things take time to build, but yeah, 100% we are looking at it. We're also working on an equivalent for System 1 as well. So, hi, is this essentially uploading letters to Docman and then review letters and forward them on to relevant teams? Yes. And filing as well. So it can file and distribute to the appropriate place. Yes, that's correct. Audio is sorted. Does it sort the documents that are scanned on? Yes. Is there an extension to the tool that will code the letters? Do you understand that, Sanj?
Yeah, so again, two parts. This does the administrative piece. So when James does the demo, we can take you through what it does do. And there is a clinical code field that it can apply, that you can train it to set, as in Normally it's set to like seen in clinic, etc. But the diagnosis in terms of codes, numeric codes and things like that, it doesn't do. This does the first layer. This will read the document within not in folder. It knows how to classify it because you've told it, you've trained it. It will then apply all of the fields that you would put as you file. So, again, event date, NHS number, folder, create review, all of those different types of information.
Thank you. Will it work for scanned documents and also yes, and also that get extracted from Docman email? And how does it work from emails that need to put onto Docman and shared to relevant team members? So, if I understand that question correctly, and please come back if I haven't, we would pick up emails in the same way. Is that the way I understood that, Sanj?
Again, it comes back to the not in folder. So will it work for scanned documents and also gets extracted from it? So as long as they are coming into the not in folder within Docman, the Docman inbox, and they've been trained and you've classified them, there is no reason why it will not file them in the exact same way that it receives any other letter type.
Thank you. On an average of 39, brilliant, thanks, 1,000 letters, how many letters are rejected? What does the system do if a letter mentions two different departments? So based on how many you've taught it to recognize at the beginning, it's going to reject all of them because it hasn't been given permission. So it's just going to read them and save them in the memory. And then as you teach them to recognize them, it will process them. When it comes back to rejected, so let's unpack a little bit, if I understand correctly, what rejected means. Rejected means hasn't been given permission to action, so it could be a new letter or new letter type. So it would be around how many, if you get a new version of that letter, that will be rejected. It was not been given permission, or specific letters that you may not want it to look after. So again, that will be down to you as to those to sit in those two buckets. The next question I'll let Sanj answer. I haven't been asked that before. What does the system do if a letter mentions two different departments?
It will apply the department that you've told it to based on that document type. So if you set that document type for emergency discharge, and on that letter you put the emergency discharge folder, department, it will apply that. If there's another department on that piece of paper, it's obviously not going to do it because you've told it. It's all about what you've told how to classify that letter.
Okay, if an action needs to be taken from one of the letters, how will it be notified? So I guess what you're asking there is how will it get to the right team on a particular letter?
I think that's in terms of creating review. So again, classifying the letter, you would apply it to the relevant person or teams to create a task. And then that would just follow the same process as if you would be filing it normally and popping it to that create review.
Thank you. I have never been asked this one before. It's an interesting one. What if a report relates to three or more family members, e.g. AFC or police reports? Will it copy to all patients? Sanj, any idea?
No, not asked that one. No. No, it will only pick up again, based on the training. So for these types of letters, you would tell the system to skip them. There's an exceptions rule in the settings. So for these types, you would simply just say skip them because the capability of the tooling will pick up one NHS number or validate the NHS number and then again apply the relevant fields that how you file within Docman.
Okay, what is the benefit of hosting? So, well, there's two ways you can use technology. You can have a physical computer at the practice that it lives on that you would have to look after. You'd have to, every time you're teaching a letter, you'd have to log into that one computer, which could be sitting in a spare room or on the end of a desk, and it would be sitting there working in the background. Or you have it delivered as a hosted service. A hosted service is the analogy I like to give is like a Netflix login. You have a login, username and password, and you use it from there. So hosting mean that the benefit of having it hosting is it's locked down, it's secure, and you can access it from anywhere. You wouldn't have to go to the practice every time you wanted to use it and sit in front of a machine. It seems to be a high level functioning than IntelliSense. Yes, it will supersede IntelliSense.
Also, with the fact that it actually files, so completing the actual filing piece.
Yeah. Okay, thank you. Yeah, the principle behind our tooling is it does the full circle. It does what it does and it doesn't do what it doesn't do. So it will grab everything, validate it, get it to the appropriate person, file it, triage it, unlimited volumes and cost. Yeah. If not a hosted service, can a local PC be used for other tasks, or does it have to be left running in the system? So we actually stopped. We used to use local PCs until we were given permission to start using hosted machines, which we formed this partnership with an NHS ICT, obviously HBL ICT, and it's just a much better way of doing it. So we actually made a decision as a business to stop using local PCs at the end of last year. Now we have the ability to deliver it as a service. What we saw with hosted with physical machines at the practice is the support and upkeep became quite challenging, physically having to go to the same place, and also there are some security concerns around having open computers that are working in the background that aren't being monitored. The hosted service is much more robust. It's locked down. Anyone can access it from anywhere. I mean, with our pathology filing product, we have clients who've got partners in the evening logging in from a laptop at home, setting rules for different pathology tests because that's the only spare time they've got. If you think about previous versions of this, they would only be able to do this at a practice. They'd have to be sitting at the practice, on a third-party machine in a spare room somewhere. So it's just a much better way of working. I presume it can be saved on a shared drive and various people can log in. Similar, what we do is you download a couple of apps. We'll download a couple of apps for you. So usually, I think it's 2 apps per product, and then whoever is going to have responsibility for coding for this scenario for Docman, you'll get a couple of apps basically, and then it will be locked down with the username and password, and you just log in, and then you'll get to MyBotGP dashboard there. So yeah, I mean, in principle, you could share a login if that's what you wanted to do. Again, how you look after it at practice level is is up to you. So some good questions there. Thank you. What we can do now is give you a quick demo. I'll let Sanj talk you through the demo, and then we can come back and see if there's any more questions. The subscription is a yearly subscription, and minimum commitment is 12 months. Just to answer Doug's question there. If I get to the main page here. To the demo, what I'll do is I will run it and pause it, and I'll let Sanj talk you through this. So I'm going to go on mute. Sanj, I can obviously hear you anyway, and I'll let you carry on. So if you tell me where to start and stop.
Thanks, James. Brilliant. Okay, let's start with this screen. So this is the main filing screen. I'll briefly explain what's happening here. So in the top left-hand corner, you've got all of the letters which it's seen. So the way it works is we plug in MyBotGP, we get the credentials for Docman. It then logs into Docman automatically. It then grabs every single letter it sees within the not in folder. It then returns each letter with the actual Docman title and back into this platform. And as you can see, it's listing out everything it's seen. Okay. Now these are all the documents that it's seen, and essentially it's requesting you to file them. And what it's asking you is, can you please train me on each letter? And so what it does, letter by letter, it provides you a thumbnail. It provides you, a preview of that letter on the right-hand side. Okay, now there are 5 steps to train a letter. And once you've trained this letter, you never have to train it again. Okay, so in the bottom half of the screen on the left-hand side it says step 1 of 5. Now the first thing it's asking me to do is asking you for a document type. So again, that's just an internal name. So I can give it an internal name, and I'll call this letter, for example, ENT letter. Okay, the keyword to search in document title is automatically populated, so you don't need to worry about that. The system picks up the document title, so nothing for the user or the super user to worry about. Then it's asking me, the next question is, well, okay, how do I uniquely classify this ENT letter? What are the main keywords I should be looking for, which can essentially classify this letter? So I'm going to say, well, keywords that I want you to look for are ENT letter. If we just play it on a bit, James. Okay, there we go. So we can see I've just given it an internal name in the ENT clinic letter. That's just any name. Then the document title in the later versions, that's automatically populated, so you don't even have to put that in now. And again, what it's asking for here is, well, okay, for this letter, I need to know, just pause it there. I just need to know what the exact keyword which will uniquely classify this letter. So every time I see those words in that letter, I will then know exactly what fields to put in terms of folder, create review, department, description, etc., etc. And that's the sort of steps 2, 3, 4, and 5. So if we scroll on now, and because I've completed step 1, I can click the black arrow to the right and move to step 2. Okay, so the next thing it's going to ask me to do here are 2 things. One is to tell MyBotGP where to pick up the NHS number. So I will then draw a blue box around the NHS number. And I'll do the exact same thing for event date. Now, you've got a number of ways one can set event date. You can say, pick up the first date, or, you can pick up a current date. Again, there are lots of options of how you can set event date, or what we find is quite common is you simply draw a box around the actual event date that you want MyBotGP to pick up. Then you tell it the exact format of that date. We just scroll on a bit. Brilliant. There we go. Couple of ways I can do this. I've told it where to put date, and just pause there slightly. Now, organization, what it's asking me here is, well, what's the name of the hospital? And then also, what's the name of the hospital within Docman? Because as we know, the name of the hospital can be abbreviated within Docman, so I have to tell it 2 names. If we just forward it on. Okay, so I think that's already been done. You've just gone through, yeah. So organization we've done. If we just go back a touch, James, if that's possible, to step 3. There we go, brilliant. And then, so we've done organization, we've told it within department, and it needs to be told exactly what department to put it in. So again, I just type in a free text and tell it which department. Just play that. Okay. Now, this step here, step 4, contains a number of items that it's asking you to do. So if you use templates, again, tell it what template you want to use, and you simply type in the name of the template that you want it to use for this actual document type. And it's the same process, as you can start to see as trend. It's the same of how you would normally file, but you're actually telling MyBotGP, almost training MyBotGP to essentially carry out how you file. And then once you've done it once, it never has to be done again. So templates, if you're using templates, give it the name of the template. Description, so give it, again, a description of how you want to file and the words that you want to apply there. Folder, notes, and tags, same concept. Simply telling it the exact name within Docman. Again, description, I want it to always populate ENT clinic letter in the description field within Docman, and then folder, I want you to pick up a specific folder, notes, and tags. Okay, so if you don't need to put anything in, you can just simply skip. Just to pause here, James, quickly. So again, the last step 505, are 3 things it's asking you to do: create review. So again, if you want to create a task for this particular letter, again, you simply type in the name of the actual create review, word for word, letter for letter. Clinical code, again, if it's seen in clinic or whatever that clinical code is for this particular document, you simply type in the narrative of what it will, how it will appear within Docman. If you don't want it to put in anything like persons, I can leave as is, and it'll just skip that field. And then as soon as I click save, that letter moves to an enabled state, and then I can move on to training the additional letters.
Okay, thank you, Sanj. What we will do is we'll just quickly show you the tool running. It's a quick demo. Essentially, what you're going to see is it looks like a person, just or a ghost is using Docman. It's just going to run in the background. doing its own thing, filing the letters. This box here where it says do not touch the mouse, essentially MyBotGP is working. Coming back to one of the questions we had in the Q&A about why you don't, about having computers at the practice, this is no longer valid. So this was a warning sign that came on if MyBotGP was being used as a practice, that no one should touch the computer because it's working in the background. And one of the advantages of the hosted solution, obviously, is you don't have a computer at the practice. It's all being done remotely. No data leaves your practice. Everything is still secure. We can't see anything. No one can see anything. And you have a bot which is living in a hosting center, with permissions to only look at Docman and to action letters as you see fit. So this disappears. And what you'll see now really is or did that by accident, is you'll see the tooling logging in. Again, this has been anonymized. One of our clients kindly let us share this for demo purposes. So we've redacted everything here. You're going to see MyBotGP. It's grabbed that ENT letter. It's having a think. Do I recognize this letter as the date in the place? Does it match the hospital? Does it match the date? Does it, all of the template information? Is it correct? Yes, I do. I do have permission. Everything looks correct. I'll just pause it here quickly, and then what you can see, it's just completing this in the side. You can supersede IntelliSense as we touched on before. It's done. And then again, the so what pieces, now it's validated it and done it. What's it going to do with it? Well, it will send it to where you want it sent it. Do you need to look at it? Don't you need to look at it? Does it go to a particular person or team, or is it referred somewhere else? And it will follow that logic, and which is then evidenced in the audit log. And you can see it here just working its way through the letters. So we had one of our clients this morning, I believe, I think overnight had 100 letters or 150 letters filed overnight that came into practice this morning, and all that had been filed in the evening for them. It runs every day. We run at scheduled times, and this is what it would look like if you're looking at the screen. So what we'll do is we'll come back to the questions. Before we do that, I think it's important to talk to you about how we train our clients as well. So what we do is we have client-only webinars that we run every week. We run them if we have one person, and we'll run them if we have 50 people. They're always on every Tuesday and Friday and Thursday, I believe, for an hour. On each of our products, pathology filing, repeats, prescriptions, and Docman, and you can drop into as many or as few of those as you wish. It's a running open invite for a webinar. Those webinars are quite open forums. People come in with questions, queries, ideas for enhancements. We're always looking to improve our tooling, so they're a good opportunity for people to share ideas as well. We show you how to train a document, and then different people on that call are quite they're really nice. They then share ideas amongst each other of how they've used the tool. We also have a YouTube channel with a bundle of video, a private client YouTube channel with a bundle of videos on there that's regularly updated, showing you how the functionality works. We built that because, and again, I might have said this previously on previous webinars, but we built the YouTube channel with lots of videos, some 2 minutes, 1 minute, 20 minutes, because nobody read the instruction manuals. So I think reading instruction manuals is not so prevalent anymore. So we've adapted and we built a YouTube channel. Everything's on there. And obviously we have the webinars as well to help. So if we bring this back now to the final few minutes, let's see, we'll hand over to do some more questions. And yeah, and then we'll round off. We've got about 7-8 minutes left, and we'll go through these again. If we can't answer any of these, we'll come back to you. And if anyone wants more information, please let us know. So the next one is, can you have one letter type, for example, admin letter, but have it set up for several different departments, clinical codes, i.e. admin letter, urology, DNA, appointment, and admin letter, dermatology, referred to urology? So that's a question for Sandra, I believe.
Yes, 100%. Again, one of its strengths is a single letter can be split and sent to different departments based on the keywords. So you'd set up admin letter looking for example, the keyword urology, and then you would then train it to look for the urology type settings and folders and, you know, create reviews. And then you'd set up the same letter, admin letter, to look for a different keyword. And then that essentially classifying it as a separate letter, although it's the same letter, if that makes sense. But it gives you that flexibility to take one letter and to put it to 10 or 15 or however many different departments you want to do.
Okay, thank you. Where can we find details of the results, filing, prescription webinar? So we have another pathology filing webinar, and I believe it's, what day is it? Today is Wednesday. I believe it's Wednesday week. I'll make a note of that. And we can share that directly with you. Everyone that registered for this will be on our newsletter, which I believe comes from Alicia. And we normally send that out once a month, and it will have the links for forthcoming webinars and stuff on there. I'll actually put our website in here because I think what the team have done, hang on, jeff.co.uk, what they've actually put a webinar page on our front page. I think it's the bottom left hand box, and if you click on that, that will have the option to register for additional pathology filing or Docman webinars. The prescription webinar, we've been so busy with Docman and pathology filing, so we've pushed that back a bit. We're going to start officially pushing doing webinars and content and stuff probably in about 6 weeks time. We'll start, so watch this space, and we'll officially push on repeat prescriptions at that point again. Another question: will it code if it's a problem and allergies, and also if it's a high priority to be sent through? So I think what you're asking there, unless I misunderstood, is more around what a person would do around making a decision on that letter. If you're still on the webinar, if you don't, you can jump in and say if we're correct or not. Essentially, because yes, okay, got you. Thank you. So that piece we're not touching. So that the piece that MyBotGP would do is it would grab that allergy letter. And then depending on what you do at a practice, and we've seen a lot of different protocols at different practices for what they do with allergy letters, it will triage it to the appropriate person. So we have some clients that have specific people that goes to, others have specific folders that it goes to, or they set tasks and reminders so that they can be, so they're flagged essentially as needs a person to look at it urgently. So there's any other questions? So we've got a couple of minutes left. We've got time for a couple more questions if there are any. We've still got over 50 people on the call. Okay, so yeah, just a quick roundup. So thank you to everyone for joining today. Thank you for Sanj for supporting. We run a couple of webinars a month minimum. The next one is pathology filing. Thank you. And then we'll run another one for Docman, and then so on and so forth. We have a newsletter that will go out. We'll also send you a copy of this as well. Thank you. And yeah, and I hope you found it useful, and we look forward to hearing from you. Thank you very much.